Welcome. Today, we delve into Alzheimer's disease, a devastating neurological disorder that affects millions worldwide. We'll explore its causes, symptoms, diagnosis, and the current state of treatment and research. The exact cause of Alzheimer's remains elusive, but it's likely a complex interplay of genetic, lifestyle, and environmental factors. Age is the biggest risk factor. While genetics can play a role, especially in early-onset Alzheimer's, most cases are sporadic, meaning they don't have a clear, inherited pattern. Research continues to investigate potential triggers and contributors. Alzheimer's disease is characterized by two primary pathological hallmarks in the brain: amyloid plaques and neurofibrillary tangles. Amyloid plaques are clumps of beta-amyloid protein that accumulate between nerve cells, disrupting cell function. Neurofibrillary tangles are twisted fibers of tau protein that build up inside nerve cells, eventually leading to cell death. These changes initially affect brain regions crucial for memory and learning, such as the hippocampus, and gradually spread to other areas. Alzheimer's disease is a significant public health concern. Its prevalence increases dramatically with age. It's estimated that millions of people worldwide are living with Alzheimer's, and this number is projected to rise significantly as the global population ages. The disease impacts individuals, families, and healthcare systems, placing a substantial burden on society. The symptoms of Alzheimer's disease are progressive, meaning they worsen over time. Early symptoms often include memory loss, particularly difficulty remembering newly learned information. As the disease progresses, individuals may experience confusion, disorientation, difficulty with language, problems with visual and spatial skills, and changes in personality and behavior. Eventually, individuals may lose the ability to perform everyday tasks and require complete care. Diagnosing Alzheimer's disease involves a comprehensive evaluation, including a medical history, physical and neurological exam, cognitive and functional assessments, and brain imaging. Cognitive tests assess memory, attention, language, and problem-solving abilities. Brain imaging, such as MRI and PET scans, can help identify structural changes in the brain and detect amyloid plaques. A definitive diagnosis can only be made after death through examination of brain tissue, but clinical diagnoses are highly accurate. While there aren't distinct classifications or types in the traditional sense, Alzheimer's can be categorized by its age of onset. Early-onset Alzheimer's, which is less common, typically appears before age 65 and is often associated with genetic mutations. Late-onset Alzheimer's, the more prevalent form, usually develops after age 65. Currently, there is no cure for Alzheimer's disease. However, there are treatments available that can help manage symptoms and improve quality of life. Medications, such as cholinesterase inhibitors and memantine, can temporarily improve cognitive function. Non-pharmacological interventions, such as cognitive training, physical exercise, and social engagement, can also be beneficial. Managing behavioral symptoms, such as agitation and depression, is an important aspect of care. While there's no guaranteed way to prevent Alzheimer's, adopting a healthy lifestyle may reduce the risk. This includes engaging in regular physical activity, maintaining a healthy diet, staying mentally active, managing cardiovascular risk factors such as high blood pressure and cholesterol, and getting enough sleep. Research is ongoing to identify other potential preventive strategies. Alzheimer's disease is a progressive and ultimately fatal condition. The rate of progression varies from person to person. Research is actively pursuing new treatments and diagnostic tools. Promising areas of investigation include disease-modifying therapies that target amyloid plaques and neurofibrillary tangles, as well as biomarkers that can detect the disease in its earliest stages, even before symptoms appear. The hope is to develop interventions that can prevent, delay, or slow the progression of this devastating disease.